Welcome to your Meditech PCS Worklist overview training video. This video will show you how to navigate the worklist and explain some of the functionality of the electronic medical record. The worklist predominantly contains the nursing assessments that need to be completed as part of the patient's care. When an adult patient is admitted to a ward area, an admission bundle is added automatically to the worklist. The bundle contains the assessments that must be completed on admission. To aid that process, a default schedule is assigned to the majority of the assessments based on how often it must be completed. The schedule can be adjusted by clicking on it and selecting a different option. This must be done when the frequency of assessments such as observations, fluid balance, or skin bundle changes. The different schedules indicate different time intervals. Q3D means every 3 days, Q7D every 7 days or weekly. The next column displays any protocols contained within the assessments. Clicking on the question mark explains the meaning of the symbols. Once an assessment is scheduled, clocks will appear on the work list to prompt completion. If you approach the time an assessment is due, click in the box next to the clock and then select Document. Fill out the assessments and then click on Save and Exit. If you are late completing an assessment and the clock has gone red, do not tick the box, but use the Now column. Place a tick in that column for the assessment you are completing, select Document, and once you have filled out the form, click on Save and Exit. As the system refreshes, the red clock will be removed. The status board will also be updated. If you need to update an assessment outside of the schedule clocks, for example fluid balance, place a tick in the Now column and select Document. The last done column on the work list displays how many days have passed since an assessment was completed. This is useful to check, particularly if there doesn't appear to be a schedule clock to prompt completion. Clicking on the last done or status due headings will reorder the work list accordingly. If additional assessments are required, click Add at the bottom of the screen and type in the assessment needed. Click on that assessment and select Save. To cancel an assessment from the work list, click in the appropriate row in the Status Due column and select Cancelled from the options. Do not use Complete, as it doesn't allow for the assessment to be added again to the work list. You will notice this has happened when you try to re-add an assessment and it is greyed out. In this situation, the Change View function will need to be used. From the menu that follows, select Complete and say OK. Any assessments completed will be displayed. Click on the word Completed in the Status Due column and convert back to active. The Worklist view also displays other important information that is useful to patient care. The banner bar at the top of the screen displays the patient demographics: height, weight, BMI and allergies. The tabs down the right-hand side of the screen take you to different aspects of the patient's electronic medical record. Status Board tab returns you to the status board. Select Visits allows the user to select different patient accounts or visits. The Summary tab takes you through to the summary screen of the patient's electronic medical record. From here, special indicators, allergies, home medications, etc. can be added. The Clinical Panels tab contains information pulled from a variety of assessments and documents and enables them to be viewed at a glance. The Vital Signs tab allows you to view patients' observations. The I&O tab allows for fluid balance charting to be viewed. The Medication tab stores information relating to prescribed and administered medications. The laboratory and microbiology results can be found by clicking on these tabs respectively. The Reports tab contains any documentation about the patient which is classed as a report, for example, CT scan results and discharge summaries. The Patient Care tab is where nursing assessments can be viewed once completed. The Notes tab is where all medical, therapy, emergency department, etc. notes can be viewed. The Orders tab contains a list of all referrals, investigation requests, and medications prescribed for the patient. The TTO review is used by medical staff to submit TTOs to pharmacy, and following that, by nursing staff to document the TTOs given to the patient prior to discharge. The Document tab gives access to the documents completed by every member of the multidisciplinary team, including the nurse's medicine requisition and the inpatient discharge summary. The Worklist tab returns you to the worklist. And the MAR tab, or Medication Administration Record, takes you to the patient's electronic drug card. And that's it. If you need any further guidance, please contact a member of the IT System Training team. Details on screen now. Thank you.